Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Really humble, I would say. Today we're going to talk about fixed knee pain from tight IT band. IT band, what is that, internet?
Yeah, that's the people that fix the internet. No,
Yeah, right.
iliotibial band, which is, are we going to get right into this?
Sure,
Bob?
let's get right into it.
Right, let's use Sam here for a little
Demonstration?
anatomy lesson.
Sure.
So the IT band, the ilio, we got this pink IT band here on Sam.
Right.
I do
This
have some.
is a tough, fibrous band.
Yeah.
I mean, really tough.
And it's about this wide too. It's a wide, flat band. It goes down, crosses the knee joint, connects down by the head of the fibula, over the top of the greater trochanter, the hip there. And the black tape is to represent some of the muscle it connects
Like
to.
tensor fasciolata.
Tensor fasciolata. And some fibers go actually to the medial and the
glute.
glute. The
Max.
Max, yes.
Yep.
So we've got this to deal with. Now, if this gets tight for whatever reason, it affects the mechanics of the body.
I should say, Brad, we should say not only tight, like the muscle could be tight, but it also could get bound down.
Right.
That's probably more common, is it actually is bound down.
It's kind of like this is tape, you
Right.
push it down again, see it
And it's not
sticks
working
there.
right
Yeah,
then.
we want to get it to loosen up so
It's pulling too much here, and this causes the knee to swell up, and you think I have a knee problem when you actually have an IT band problem.
Right. So now this video, I have to say I'm doing it partially for a friend of mine. He's going to be my daughter's husband, my daughter's brother-in-law. Anyways, his name is
Daughter's
Trip.
future husband's brother-in-law.
They don't care about that, Bob. But this young man, he's, I believe, 26 now. His name is Trip, and very aggressive runner.
A little nuts, if you ask me.
Well, some people said he happens to be one of these ultra runners that don't run. A marathon is not long enough.
No, they run 100 miles.
Yeah, 50 miles not enough. Go for the 100-miler. And to make it even better, he ran this most recent one in Colorado. It's about a 10,000-foot elevation, and plus it's over the hill. And
Well, I say he's nuts.
well, no, he's a fine young man.
Yeah, I'm sure he is.
He is,
but he's nuts.
well, there was
All
about, I don't know how many hundreds of people out there doing the same thing with him. A lot of them did not finish. He did finish, but he did have this pain.
And on the side of his knee, and
yeah,
became swollen.
yeah. So this is one treatment that I think would be worth, Trip, that you could do. We're going to show you a few exercises. You don't have to do all of them.
Pick out the ones you like that
Exactly.
work well for you, and go forward with those.
Right. And if you haven't run a 100-miler, a lot of people get this from just
well, you can get it from biking too.
right. Yeah, biking, any repetitive motion kind of thing. Or sometimes if you do something new that you haven't done before and you're sore, and then things can tighten up as a result. But anyways, it's pain, knee pain, oftentimes on the lateral side. And, you may be diagnosed from a doctor or a therapist. And,
Right.
So shall we get on with the exercises?
Good, Brad.
We completely wasted 3 minutes right there.
Yeah.
Well, anyways, not really. Trip's worth it. So he's a nice guy. I really enjoyed talking to him. I could never run with him though. He's way too fast. I want to do it this way. So IT band, and these exercises are actually good for the hip too.
So basically, if you're looking at Brad's pants, the IT band is kind of the white stripe.
Exactly. Yep. From here, except for it stops right there, not down to the ankle. Now, I'm just going to start with a hamstring stretch.
Right.
If you happen to have tight IT band, and if you have tight hamstrings, you should get those.
Yes.
So you're going to start out here, straight knee, 15 to 30 seconds there. And then we're going to go into the figure 4 stretch. This comes up. Here's stretch number 2.
Now you're still stretching the left one here.
Yes, exactly, Bob. Good point. Push down here. And then come under here.
This can add a lot here.
It does. This is for the advanced, which Trip would be able to do.
Again, not so much stretching the IT band here as you're stretching the tensor fasciolata and maybe the glute max a little bit. So things that attach into the band.
Right. Yeah. So we want to get surrounding structures as well in general. Now I like this one. Put this leg down straight, and then this is where you really benefit from a strap. You can use a belt and put a loop on the belt, but you're going to go over this way,
There you go.
and I'm pulling here to control it, getting that stretch all the way across. Oh yes, this is wonderful. Hold that for 15 to 30 seconds. Okay, now the quadricep may be adjacent muscle to the IT band.
Right.
We want to stretch that, so you can do that.
Often
simply.
often tight to people. It's good what to do.
You can't. You don't even need the strap if you can reach
Right.
your ankle and pull here. Now the trick to this one is doing this motion. Right here is not going to do the quad any good, but
Right.
you've got to go
You
this
just bend
way.
to the knee.
Whoa! Now it's lighting them up a little bit.
Right.
There we go. And the last one to get the IT band, this one actually, let me do it this way. If you're on your edge of your bed, you'll take, this is the one I'm stretching, go off the edge and leave it hang and use gravity and just kind of hang out and let that stretch right in there.
You remember that one that your friend did that ran triathlons and he was
Oh,
like 60,
yeah.
the seated one?
Yep. Dan.
Yeah, that's the only thing he did.
Yeah.
It's
Yeah, he had
awesome.
knee pain, and
Yeah.
this is what he did. And he
crossed
pulled
over
it this way.
again, stretching the left one.
Yep. Yeah, I'm glad you brought that one
Yeah.
up, Bob. Yep. Boy,
he,
yeah,
he had good luck with that.
Yeah, he could hardly walk.
Right.
He was getting to the point walking was sometimes painful.
It was an amazing story, to be honest
Yeah,
with you, because he was going to give up. I mean, he couldn't even walk.
Yeah.
He was going to give it all up, and,
Yeah.
and he ended up running.
Yeah, he went to a PT and he started doing this, and he was grateful.
Yeah.
Yeah, he was like 60 some years old. He's still
Right,
running and
right.
doing his activities.
So when I'm talking massage gun spread,
Yeah, like we're mentioned before, if that, say the IT band
It's
here's where
bound
the stripes
down.
are, you can stretch it as we did that, pick out a few of those stretches, but to break that, if it is adhesed or bound
and
down,
often is.
yeah, you can get in there by your hands and do what I'm doing here and do some cross fiber and get in deep, and you'll find that that'll help. And you also find that your hands and fingers become fatigued after about a minute, depends on how tough you are. I'm already getting fatigued.
Yeah, I already did both sides.
Yeah.
I mean, you're just doing one side.
Yep. Or, if you happen to have a massage gun, which Trip does because I gave him one.
Sure. In this case, I would say this is where you want to spend your time. I mean, and your money. It's
Yeah.
going to be well worth your time and money to use a massage gun.
Now, Bob is going directly in. He's got
Pretty aggressive. I got the metal head. And actually, this is probably the most aggressive head, maybe the bullet head too.
Sure.
But this is maybe a good way to start.
I'm using the one with the round ball.
Yeah.
Here, you see this. And Bob's pretty tough. I don't like that head. It's a little too aggressive for me. I'm going to go this way, and I'm actually going to turn it sideways because this reciprocates this way, and that'll help break up that adhesive. And you can go directly in.
Yeah, it won't bounce along as much.
But that's too much for me. And Trip's a thinner guy, so he probably is not going to go
start that way.
Yeah,
Right.
exactly. And it's important. If you find your hip bone here, don't go directly onto that.
Right.
There's a bursa there, and you don't want to irritate. It doesn't feel good anyways, unless you're kind of unusual. So let's get up.
We got two guns here. This is the T2, more for the athlete, big, powerful gun.
Yeah.
And this one has plenty of power too, but it's not as powerful as this one.
So we got the T2
and the C2.
T is in Trip.
Right.
Yeah.
There we go.
And then the C2, C is in cat.
R2D2, C2.
Yeah. So I like to get in here, and I just think it feels good to get these
that
hip
tension
muscles.
a lot.
Yeah.
Oh, wow.
Yeah, see what I'm talking about?
Yeah.
Kind of lights you up. Whoa. Anyways, we
Life
better.
is good.
Yeah. Good.
You want to show the wall stretch or not?
Yeah, I
in
do.
In case you're at an event and you can't get on the ground because it's all wet.
That's a good point. Yeah.
Quite often that's the case.
Well, they started this race like at 4 o'clock, 4 a.m. and I think the goal for Trip was 24 hours. He wanted to get it done. I think it
Can
took
you
him.
imagine running for 24 hours?
No. no.
I can't even stay up for 10.
Yeah,
I just take a nap.
he went through the race for me like at mile 10. He was feeling good, but by like mile 40, if I remember right, things were starting to
Oh,
ache.
really?
And it's like he had 30
Mile
miles to
40.
go, and I couldn't even believe he was standing.
Yeah.
So before race, you can do this. I'm going to stretch my right one. So put
Right.
the right leg here.
Correct.
Take the other one and cross in front. That's not that's just hanging there. It's a place to put it. And now I'm going to move my hips in this way, and that pulls here and stretches that out. And this is one I think you can do a little dynamic stretch like this as
Yeah,
well.
very good. That's a good one before the race.
Yeah.
The other ones you want to do throughout the weeks before to really stretch it out.
Right, exactly.
Yeah.
So, boy, Trip,
That should help.
excellent job on that endeavor and that adventure. And if you, I'm a little cautious on saying and doing another one because I don't want something to happen to them.
Yeah.
Yeah, stick to marathons maybe.
All right.
Good luck.
Thanks for watching.